Well, as the number of people diagnosed with coronavirus in Australia continues to rise, so does the uncertainty around it.
Now, we asked you what you wanted to know about the disease, the illness, and we've been inundated with questions, and here to answer them is Professor Ramon Shaban, who is the Clinical Chair of Infection Prevention and Disease Control at Sydney University. Thank you so much for taking the time to come and speak to us. Of course, Professor, there's a lot of panic over this. There's a lot of information out there to sift through for many people. And one of the questions we want to get straight into is the question of immunity. This is a lot of the questions that we got basically said, if you get coronavirus, do you then build immunity and so you can't get coronavirus again?
At this stage, we're not exactly sure. We're very early on into this outbreak, but it would appear that this outbreak, this infection behaves like most other respiratory viruses. So we would anticipate that people who have the infection will develop some sort of immune response.
Another question we've got in from Hugh is, how long is this outbreak going to last? I mean, is that like asking how long is a piece of string, or do we have an indication?
We would expect that this will go on for some months over time. As countries experience more and more cases, as we've seen in Italy, in South Korea, the infection will sustain within communities over some months to come.
Sue has written in too, and Sue's from Brisbane, and she asks, at what point do I pull my immune-compromised teen out of school and his part-time job? Already we've seen his school, some staff, some students being asked to self-isolate because we've had a boy that was infected. So talk to us about this.
It's very important that if anybody has any other medical conditions, that they first talk to their doctor. With this particular case, not all immune conditions are the same. So the first port of call is ask your doctor, seek advice about their specific care plan, and then take action according to what the doctor then does say. So.
This question is from Jane in Sydney. She said, what happens if one family member contracts the virus? Should other family members stay in quarantine at home too, or should they maybe stay somewhere else for a while?
Yes, the family will need to make some sort of arrangements. So often it might be useful to place that person into one of the bedrooms to limit interaction within that household. If somebody in that household is unwell, they have other conditions, they may like to make other arrangements for the period of incubation. But it's important that families do begin to plan now. So family planning for an outbreak should occur now. What would we do if mum becomes unwell? What would we do if, dad becomes unwell? If, the firstborn son who's in grade 9 at school becomes unwell, how do we care for him over the next 2 weeks? Planning is vital at this point in time.
In terms of self-isolation, what does that mean? You said that if one family member is ill, isolate them in a particular room. But what about the rest of the family? And these are really simple questions like, well, what if we all share the same air conditioning? Does that mean that we're all going to be infected as well?
Yes, and that goes back to family planning. So families, households should plan for these kinds of processes, and it will inevitably involve making temporary arrangements to stay with friends, stay with other relatives in that space. The key to this is planning. The infection is here. It's here to stay for quite some time. We're not going to be able to contain it, as we've heard from many experts around the world. And so when infections do arise like this, we need to plan for their eventuality. Not everyone's going to get this infection. Not everyone has the same risks, but families can plan. Communities can plan. Neighbours can plan. What do we do if the elderly friend who lives next door, who lives by herself, gets it? How will we support her? That's vital in any of these kinds of outbreaks.
Alex from Perth, his understanding is it takes 15 minutes of face-to-face contact to catch coronavirus. So his question is, can he head down to the local coffee shop, get himself a coffee? Is he going to be exposed if someone has coronavirus? The
short answer is no. So that 15 minutes is a guideline. If Alex has coronavirus, Alex should stay home, follow advice. Alex can go outside in his local courtyard, but he's not advised to go outside to cafes, shopping centres, because that's where infections do in fact spread.
Talia, who's writing in from Hobart, and I think this is a very important question here. What are the risks to pregnant women? What will happen if an expectant mother is infected? What does happen to the fetus?
Similarly, this is very early on in this outbreak. Pregnant women should also seek advice from their treating physician, from the treating obstetrician, because they may have other conditions which warrant further investigation. As we've said all along, first seek medical advice for your own specific circumstance.
You know, when you say seek medical advice, you know, yesterday we were talking to a couple of doctors who basically said that GPs are also quite concerned that they may catch, you know, coronavirus. So when you say seek advice, would you advise people to call ahead of time or just present themselves?
Yes, there are a range of mechanisms. First is to call your local GP. People can ring the 1-800 Health Direct number, which is a free call across Australia. They can contact the local hospital by phone. There are a range of measures which don't require physical presentation to seek advice, to forewarn and to seek advice about what they can or can't do prior to attending their practice in that kind of way.
Erin from Sydney has also asked about how this might affect pets and animals. So if you've got the coronavirus and you're isolating at home, should you send your pet somewhere else?
It's unlikely that pets will in fact contract coronavirus, and in actual fact coronavirus is an animal-based infection originally. So it's what we call a zoonosis. So we've got no evidence to suspect that my dog or my cat will catch coronavirus if I have coronavirus.
This is one, and I don't know where it's come from really. What recipes would you recommend when using toilet paper? That's all right. We get these questions, we don't know where they come from.
Yes,
it's anonymous
there's many of those kinds of questions that come through. So, we know we don't need to stockpile toilet paper.
Well, that's the thing,
yes.
isn't it?
What's important is that people take good precautions to think about what they might need for a 14-day period. We have home delivery services in Australia. We have very strong food supply chains in Australia. Panic buying does not help anybody. And in fact, what it does do, it can and does compromise people who may need support services and resources when they go to the shop and they don't have them when they're there. So it requires some sense of moderation.
We've also got some questions about people coming in from overseas. So Jen is wondering why we aren't quarantining all incoming travellers for 14 days. But we've also got a question about the details of testing, because this person understands that the US has had some issues with testing. So what about travellers coming in from overseas?
The decision to invoke travel bans on countries is based on a range of factors. But importantly, one of those factors is the strength of the individual country's public health system. So economies in high-income countries tend to have very strong public health systems, and so we rely upon the veracity of those systems to detect infections in that kind of way. Other countries do not, and so in some instances we have to invoke some travel bans around those countries.
Now, you're a huge advocate for trying to get a plan in place, particularly for families.
It's absolutely vital that families, households think about options about what to do if somebody becomes unwell. What do you do if mum becomes unwell, dad becomes unwell, one of the children becomes unwell? Who looks after the shopping? Who looks after the grandparents? Family planning is very important. So I'm suggesting to people, sit down with your families, with your households, have a discussion, think about options as to who will do what over what period of time in the coming weeks and months ahead.
How do they know what to include in that plan? Is there a way they can seek advice on whether, for example, if you've got kids, whether one of them, if one of them contracts coronavirus, what to do in that situation?
There is an enormous range of information available for households, families, on a range of government websites. The federal government has a range of fact sheets about what to do when. Each state and territory have also similar fact sheets and advice. And of course, you can ring the Health Direct number. There's a national number to ring. It's toll-free to ask questions about all of these kinds of issues. Absolutely.
One of the questions that we got a little earlier too was a question about, well, how do you self-isolate? And we're talking about family planning here. So let's just say there's a child that's contracted coronavirus, a family member's contracted coronavirus.
Sure.
So they're self-isolating in the same house, or should they be moved to somewhere else, a different house?
Families will be provided advice by the local public health unit, and they'll be asked to consider, is it best to rearrange the household for a period of time? In other words, can some folks stay with family friends or relative? And so it depends on the local circumstance. But in a household unit, if somebody does have coronavirus disease, they should stay within one room of the house, sleep in one room of the house. Others should not sleep in that same room, and try try to minimise their interactions as best as what they can.
But this is where the whole issue of close contact comes in as well. A lot of people are very concerned about this, and there's a lot of misinformation about this. You know, earlier on we had this question of, well, if I go to a coffee shop and can I get coronavirus from a barista? But you're more likely to get a coronavirus from a family member because that's close contact. Is that right?
Correct. So going to a coffee shop to get a coffee is a low-risk activity because it goes to a whole range of factors, including the length of time you spend with others who may be infected, whether or not you shake hands, touch them, are close enough to have droplets move via the air. So in general terms, it goes back to making sure that we can break the chain of infection. And in other words, use good level of alcohol-based hand sanitizer. If you are unwell and you have been sent home on home quarantine for coronavirus, using a mask to limit the spread of droplets is a really important, effective measure. And so these are basic measures that patients are advised by public health units around the country.
We've got a question in from Gavin, and he wants to know whether the virus survives on surfaces, and if so, how long for?
Coronaviruses are not very hardy. In other words, they don't tend to survive on a surface for very long, and they are easily destroyed using really basic, commercially grade disinfectants from any sort of supermarket.
So without those disinfectants, how long would it last on
Not
surface?
very long in usual terms. So hours if at all. So
Okay, all right. Miles has written in about a question that's quite close to my heart. I take public transport quite a lot as well, and I remember being on the bus yesterday just thinking, am I sitting here and endangering myself by touching all these surfaces that are here? So Miles says, can the virus be transmitted on planes and buses between passengers? Firstly through the surface and through the air cornice as well.
This infection spread via contact and droplet transmission. So if the infection is on a surface such as a handrail or a seat or a tray table, and then you wipe that surface and rub your face or rub your eye, that's how infection does occur. So if you can break that chain by using a wipe to decontaminate the surface before you interact with it, that's the way to go. So carrying an alcohol-based hand rub is important, and the regular use of that hand rub so that if whatever gets onto your hands is destroyed, will protect you.
Miles also wanted to know about that 14-day recommended isolation period and whether that is long enough. Are we sure?
Yeah, so based on the evidence that we have to date, and this is increasingly strong, the incubation period goes up to 14 days. For the vast majority of patients, it's less than that, but the upper limit is certainly 14 days.
Richard wrote in to ask, why the panic buying? Surely isolation for 14 days, you don't need to panic buy.
Yeah, well, we think that panic buying is a symptom of perhaps the lack of family planning around an outbreak. And so it's important that people take measures to deal with everyday life activities such as stocking the house with foodstuffs. But if we have a plan around what we can get access to when, that will alleviate the need to perhaps panic buy and to stock our households with more stuff than we might need for 14 days. So it goes back to family planning. So if somebody who does do the majority of the shopping for the household becomes unwell, how do we then organise to get foodstuffs or stock for the house? Who will do that? Is it delivery on home? Is it the neighbour? So having those kinds of discussions now are really very important to figuring out how will we then get through the weeks ahead if somebody does become unwell.
Yeah. We had a lot of questions on the topic of immunity. So if someone can get coronavirus twice, or perhaps if they've had it once, then are they safe? And also a question about whether we've seen the virus mutate in any way.
It's very early on the outbreak to come to understand whether or not somebody who has had the infection has any strong level of immunity. And scientists around the world are gathering evidence to answer that exact question. We believe in general terms that this is behaving a lot like any other respiratory virus, and so we expect that individuals who have had the infection will develop an immune response to that subsequent infection. When it comes to mutation, similarly, scientists around the world are looking at the virus very closely, and recent studies have suggested that there's been no evidence of changes in the genetic structure of the virus, and so we're taking samples from patients who've been affected, looking at them genetically, and there's been no sort of evidence that suggests that there is a mutation at this point.
We've talked a lot about what happens if we get the virus. What does recovery look like? Because we have heard of cases where people have recovered. What does that look like? Is it like recovering from the flu?
Absolutely. It's just like the flu. So in terms of a clinical recovery, well, we talk about recovery as being somebody who no longer has the symptoms for at least 24 hours. And these symptoms are usually or typically fever, sore throat, shortness of breath and cough. So once those symptoms have abated and they've resolved, and if they are a confirmed patient, of course, and their tests come back negative, together with a lack of symptoms, suggests that patients have recovered.
Professor Ramon Shaban, we really appreciate you coming in and answering those.
Thank
Very
you
welcome.
so
Thank you
much.
so much.
Pleasure.
And I understand that the Professor will also be answering some more questions on Twitter, or on social media. So if you've got any more, keep them coming in and we'll try to get to them in other weeks as well.